Hey guys, today I wanted to speak to dentists, hygienists, and the entire team so that we all know how to get our patients to want what they need. And today is specifically about gingivitis and periodontitis. It's super important that we understand what our patient values and how do we get patients to be curious and want what they need. Here are two simple tips for you. Before we lay our patient back in the chair and start using our instruments, we want to explain to our patient that we are going to use a ruler to check for any gum abnormalities. We're checking for health or disease. And we nix that word probe. We only probe aliens, right? We're going to use a ruler. Mr. Patient, I'm going to use this ruler and I'll take some measurements. Super important, guys, is that you call out the numbers and let your patient know that you're going to call out these numbers and tell them what the numbers mean. For example, Mr. Patient, if you hear me call out 1 through 3, that means that your gums are usually healthy. A 4 means inflammation, and a 5 means gum infection. Notice how I said words that patients can easily accept and understand, like inflammation and infection. And then I'm going to go back and say to my patient, and Mr. Patient, when I'm all finished, I'm going to ask you what was the highest number and the lowest number I called out. Now, what do you think happens when they hear you calling out 434, 545, bleeding, bleeding on number 12, mesial, bleeding on number 15, distal and mesial, number 31, bleeding in approximately 656, 434. They're immediately, 90% of the time, when you set your patient up to understand, number one, what the numbers mean, that you call out bleeding, and that you ask them to listen and engage. You have a patient who's usually telling you, oh, that didn't sound good. And by the way, I also recommend that you let your patients know if you hear a 5 or anything higher, I want you to know, Mr. Patient, that we're going to create a plan together so that your gums are healthy. Some other tips are take pictures of pus, suppuration, heavy bridges of calculus, bleeding points, even broken fillings, holes in their teeth. And when you sit your patient up to show them knee to knee, eye to eye, not while they're laying back, but you're going to sit them up and ask them, Mr. Patient, what do you see? Do you like what you see? Ask them questions to engage them. And be sure to come over to our YouTube channel, Dental Practice Solutions. I have many tips to boost productivity in your hygiene department so you can stop working so hard. Thank you for joining me, and I'll see you very soon on the next video. Bye for now.